The Rise and Shine Partners Learning event, we've learned a lot.
We come together under the Rise and Shine umbrella, whereby partners that have been funded by Comic Relief, partners like ECD Network, Kanko, Madrasa Early Childhood Program, Andy, just to mention a few, come together to share and learn in a workshop for a few days. Just what are we doing? Where are we? What do we need to unlearn or relearn from each other? And what are we promising that we will cascade so that all children in Kenya, regardless of the different parts of the counties we serve, all children are able to receive quality through the work that Comic Relief is supporting us to do.
Every partner is doing something different. You find there is one who is doing on special needs. You find that there's a lot of inclusiveness, and then they have targeted the special need, so that you find that if a partner talks about, oh, we've been engaging males of special needs, and therefore through the various dialogues groups that we had with them, we are able to do 1, 2, 3 things. So for us, when you come to Kiambu County, from what we are learning from there, we try to complement what that partner shared.
Many partners, by the way, got to know about the ECD network, about the conferences that we hold, and they were mobilized. Like last year in our 4th National ECD Stakeholders Conference, quite a number of Rise and Shine participants participated by not only attending but making presentations on what they are doing, and that was now disseminating to many people from 23 counties and even 10 countries that participated in that conference.
I love the Rise and Shine partnership, and I would want the learning events to continue, the learning events that we usually do, because these learning events are eye-openers. You're able to know, you remember there's some meetings where we were discussing issues of policies, how the policies are being implemented. And that's why you're able to even empower the team that we're working with to say policies are made by the national government. The county government, because of devolution, county government is a function of county government to implement. So for these learning events, it's good they continue.
Comic Relief should think about scaling up and supporting the partners to actually continue the great work that we're doing, because there's need. There's need to scale up in more parts of the country, not necessarily in the county, and there's need to strengthen and create quality so that Kiambu can be a story to tell, and when others want to come in the future, they say, whatever happened in Malezi Bora in Kiambu, we want that replicated in other counties.
Welcome. This is Munaweza, who's going to facilitate the webinar today. We are glad that you are able to join us. This is the third webinar in a series that builds up from the last national ECD conference that we held. And this specific third webinar will focus on the policy landscape that is governing ECD. And there will be discussions on key frameworks, the challenges, opportunities for advocacy implementation. So over the next hour, we have highly experienced experts who will share with us their insights and also spare some time to respond to your questions. But to set us off, let me just invite a board member, Lily Oyare, of the board member of ECD Network and also CEO of Little Rock, to make her welcome remarks.
Good afternoon, morning to everyone. Ladies and gentlemen, on behalf of ECD Network for Kenya Board of Directors and the ECD NEC Secretariat, I'm delighted to welcome you to the webinar titled Policy on ECD in Kenya. The ECD Network for Kenya is a national membership organization established in 2015 to bridge the coordination gap in ECD initiatives across the country. Our primary mission is to ensure coordinated actions among all ECD stakeholders in Kenya and to be the voice for children. We strive to foster strong multi-sectoral collaboration to advance nurturing care for ECD. As a membership organization, we currently have 15 member organizations, 60 individuals, and 45 advocacy partners. I encourage those who have not yet joined the network to consider doing so today. ECD NEC collaborates with national line ministries and relevant county departments through the Council of Governors, the COG. Through our membership, we have extended our reach to 34 out of the 47 counties. In our research efforts, we are undertaking 2 significant projects. The first focuses on ECD systems measurement study, guided by 4 thematic areas: ECD financing, policy, multi-sectoral coordination, and governance. The second project is randomized control trials, RCT, dubbed Msingi Bora, aimed at promoting responsive caregiving. In advocacy, ECDNEC is working with the Lake Region Economic Bloc to enhance coordination through a multi-sectoral collaboration approach. This initiative brings together past spouses, county commissioners, county leadership from relevant departments, and CSOs, both national and grassroots, to address issues affecting children. With support from AFCAN, ECDNEC has launched a childcare dialogue campaign targeting children aged 0 to 5 years in Kenya. The campaign themed universal access to quality childcare and protection services for children 0 to 5 years in Kenya runs from June to December 2024. This initiative is also being conducted in 5 other African countries. Through this campaign, ECDNEC aims to raise a national awareness across the importance of quality and affordable childcare to highlight the evidence and milestones in childcare in the country. The National Childcare Dialogue campaign is guided by the Technical Working Group, TWG, and plans are currently underway to convey convene a National Childcare Dialogue event scheduled for November 14th, 2024. We invite everyone to join us in amplifying the need for quality childcare and child protection services in Kenya. Regarding partnership and coordination, ECD-NEC convenes national ECD conferences and webinars. We are currently planning for the 6th National ECD Stakeholders Conference scheduled for 2025 in Garissa County. Additionally, we pride ourselves through the ECD-NEC 2024-2025 webinar series, which serves as a platform for knowledge sharing and learning. This series allows partners from both state and non-state sectors to showcase successful and innovative ECD programs and interventions, share evidence-based research findings, and enhance network and collaboration among ECD stakeholders. ECD-NEC has held these successful webinars, 3 successful webinars. The first focused on governance in ECD, the second centered on multi-sectoral coordination and collaboration in ECD, and the third one focused on sustaining and scaling up change in ECD. Today, the ECD-NEC warmly welcomes all of you to join us as we delve into the policies on ECD, early childhood development, ECD in Kenya. Our discussions will cover several important areas, including education systems that foster early learning opportunities, the creation of a supportive policy environment for children aged 0 to 5 years, and the strides our country has made in advancing policies related to children's health, protection, education, and childcare. We will also explore ways to strengthen the implementation of these crucial policies. Look forward to fruitful discussions and insights that will advance the ECD agenda in Kenya. I urge all partners to join forces with ECD-NEC in amplifying children's voices for holistic development. Thank you.
Thank you very much, Lily, Madam Lily Oyare. She's the board member of ECD Network. For those who have joined us, we have just had welcome remarks from her. We are about to go into the series of speakers that we have lined up today. We advise that as we do that, you can drop your feedback in chat. If there are any questions, please share with us on chat as we proceed. And we endeavor and hope that we will have some time towards the end of this webinar for response to those questions that you will have raised. In the meantime, I want to invite the first speaker. She's Ms. Emis Njeru. She's the director of ECD at the Ministry of Education. She is head of the correct heading is Head of Directorate of Early Childhood Education at the Ministry of Education. Her role is to guide policy formulation and review, develop and administer pre-primary education standards and norms, and curriculum implementation, including teacher capacity building for pre-primary education. As head of the directorate, he has excellent knowledge of the sector and of working relationships with the county directors of ECDE and the Council of Governors. And she also coordinates National Early Childhood Education Committee. So I take this opportunity to invite Ms. Emis Njeru, Director ECD MOE, to speak to us on the topic education systems that promote early learning opportunities. Welcome.
Thank you very much. As you have heard, my name is Emis Njeru. I'm the director of ECD at the Ministry of Education. I'll be taking you through the education systems that promote early learning opportunities for learners aged 4 and 5. I will request, yes, and I want to say this is a very critical stage for children, and because it enhances the cognitive development and the emotional skills for children at this age. And therefore, foundational learning for children in under 4 and 5, or children between 4 and 5 up to 6, is very critical to enhance their literacy and numeracy skills, and also to acquire other skills that are critical for children and the adults, because it is this thing that children grasp what is taught, what they see, and what is implemented in the society. And therefore, pre-primary education is very key for these children at this age. Proceed, Kaidre. Yeah, in Kenya, we have specific learning areas that teachers are supposed to instill in children. And here we are talking about activities because we don't expect children to just dive into studying these languages, but enjoy the process of learning. And that's why we refer to them as activities, language activities, mathematical activities, all that. And you can see we also have environmental activities, creative activities. It is through this that even these children acquire social emotional skills, because in the process they learn, they act, they demonstrate, and they share, which is very critical for these children in this category of age. Yeah. In pre-primary education, we are guided by various policies and legal frameworks that we have put in place as the government of Kenya. We have the Constitution of Kenya. We have various acts of parliament, policies. We have the competency-based curriculum, which guides on what should be taught in our schools, and we expect teachers to use it. We have a requirement. They are supposed to use a certain book which prescribes the kind of books to be used in teaching, so that learners are taught in the appropriate information, and teachers are guided on what to teach and in this category of children. We also have a teacher qualification. Who should teach these children? There is a specific guideline from the Ministry of Education and the SRC and the Teacher Service Commission, which guides on who should be a teacher. Because any teacher, a person who is described as a teacher, should be a professional who is skilled to know how to handle children. Another aspect of pre-primary education is data and research. We cannot improve unless we know how we are doing. And therefore, research is very critical. And this one also helps in policy reviews, policy development, and decision makings. Let's continue, please. At county level, they employ teachers. They ensure the infrastructure is appropriate. They also deal at that level, they manage data for ECD, that's a pre-primary education. Also, they are the ones who procure relevant learning materials. And that's why I put the two levels, the national and the county. Because at the national level, it deals with policies, legal frameworks, and quality. Proceed. In pre-primary education in Kenya, we are guided by international obligations and treaties. For example, the Sustainable Development Goal 4.2 and Target 4.2.2, where we are supposed to ensure both girls and boys participate in foundational learning. And we report on how we are achieving this annually. We are also guided by the Continental Education Strategy for Africa, CESA 2016-2015, and now we are in the process of reviewing this CESA 2025 because Kenya is also guided by regional obligations or treaties. We are also implementing Tashkent Declaration and Commitment to Action, whereby policymakers met in 2022 and agreed on various aspects or various thematic areas on how they were going to ensure pre-primary education was effective in their respective countries. Currently, we have a framework for action which has identified various areas that countries are supposed to improve, especially on financing, on delivery of pre-primary education, on the environment for children, on play-based learning. All these are in the framework for action 2024, which Kenya is obligated to adhere to. We also have UNESCO Institute of Statistics, which also calls on the national government to provide data for ECD learners in Kenya. And therefore, Kenya at the moment, we have embarked on what we refer to as Kenya Education Management Information System, whereby we want to collect the data, real-time data for all learners in Kenya in PP1, PP2, so that the government can also make decisions for grade 1 going forward. We already have a module in place, and soon we are going to have it implemented. We proceed, please. Let's move to the next slide. I've not finished. Okay. I don't know what has happened.
This slide looks, so
there was
there is
disconnection. Yes.
Looks like,
yeah.
Thank you. She had gone, she was, proceed. I think the next slide.
Move to the next slide, please. We have challenges or national gaps. We have lack of accurate data, inappropriate infrastructure. When we talk of inappropriate, we mean learners are supposed to have age-appropriate infrastructure so that they can be comfortable as they learn. We have segmentation of ECD. Some ECDs are not in primary schools, public primary schools. Others are in various centers, and therefore there is segmentation, giving a challenge of management. We have lack of enforcement mechanism for provision of learning materials. We expect the counties to use the knowledge book, but in most cases, there's a challenge of ensuring each and every county purchase the required learning materials for this age group. We have lack of standardized employment and remuneration of teachers. Some teachers are not well paid, others are well paid, others are not well trained, and this one also has influenced the provision of quality education for ECD. Let's move to the next slide, please. Yes, for Kenya to have efficient and quality provision of ECE, we require some of these aspects, and the major one is ECE financing. We are calling upon the government, and in fact, it's an obligation from CESA, that is Continental Strategy for Africa, that countries are supposed to enhance finance for ECE in order to provide quality foundational learning. But we require other aspects like provision of safe and secure learning environment, provision of appropriate learning materials, teacher capacity building. Teachers should be capacity built. And we also require capacity building on governance and management at both the national and county level, so that the people who are managing ECE can know what is expected of them, how to manage, how to procure various resources, etc. And also we require sensitization of stakeholders so that they can be fully involved, and this entails involvement of parents, involvement of policymakers at county level, involvement of the community, so that they can appreciate the foundational learning in their areas. Then lastly, we need to monitor and evaluate the provision of this program in our both at national and county levels, to see whether, or to evaluate whether we are achieving quality or whether we are having challenges, and how we can address those challenges, and whether the country is there is equality in the provision of this pre-primary education, so that we are all at par as a nation. And therefore, M&E is critical, and research and data management. The last slide, please. Yeah. This is just an example of appropriate learning environment. From the first picture, you can see these children are, the teacher who is teaching this knows how to deal with the CBC, that is competency-based curriculum, because this is collaborative learning. And the next picture is showing age-appropriate furniture. The children should be, the furniture should be age appropriate for each and every child, so that they don't suffer, they don't have swollen legs, they don't strain, etc. Let's move to the last slide, please. That's also collaborative, which is also enhancing social-emotional learning. And lastly, those are policy and legal documents. You can scan to download those documents so that you can get more information on education provision in Kenya for PP1, PP2. Thank you very much for listening.
Thank you very much, Director, for that very elaborate presentation, cutting across from the activities in the classroom, in the learning area, discussing the policy issues, county level needs for delivery. You've looked at the international obligations and treaties. And lastly, you have clearly highlighted the areas for intervention. That's very helpful. Thank you very much. For those who have joined us, as we continue, if there are any questions you have, for those who are joining us, if there are any questions that you have, please endeavor to write them down, and we'll have a chance for you for response at the end. I want now to invite the next speaker, Dr. Shiroya Makeba. She's a pediatrician and public health specialist working with the WHO. Dr. Shiroya has got over 15 years of experience and in implementing reproductive, maternal, newborn, child adolescent health programs at both regional, national, subnational, and even community levels. I want to invite Dr. Shiroya Makeba to take us through a presentation. She will be focusing on the enabling policy environment for children 0 to 5 years. Dr. Shiroya. Dr. Shiroya, if you could unmute. Doctor.
Dr. Shiroya, you're on mute.
Dr. Shiroya is, maybe she's not ready now. If she's not ready now, I would then ask that we move on to the next speaker who's available with us. And if the Secretariat is able to do that, that'd be very helpful, because once Dr. Shiroya is able to get back and join us, we will proceed. I would like to ask that we move on to Honorable Jezan Farouk, my apologies, since he's here, as Dr. Shiroya is organizing herself. Honorable Jezan Farouk is the County Secretary and the Head of Public Service, Mombasa County. He will be talking to us about the strides the county has made in promoting policy in children's health, protection, education, and child care. Honorable Jezan Farouk has been with the county government and has over 14 years of experience in both public and private sector. He's an advocate of the High Court and a certified public secretary, registered with the Institute of Certified Public Secretaries, Certified Secretaries. Jezan, kindly take us through your presentation. Jezan, you may need to unmute.
Mnaweza?
Yes.
We can have the next presenter to join. Jason is having some challenges.
Oh, Jason is having some challenges.
Yeah.
Okay. So Shiroya is having challenges, Jason is having challenges, and Elijah Bonyo shouldn't have challenges. We are then asking that Elijah Bonyo, who's Director of Policy Advocacy and Government Relations at World Vision Kenya, can then proceed to talk to us about strengthening policy implementation for early childhood development in Kenya. Mr. Elijah Bonyo has over 17 years of experience in public policy and government budget engagement, public accountability, human rights-based advocacy, strategy design and execution, monitoring and reporting. He holds a master's of degree in rural sociology from University of Nairobi and a Bachelor of Arts degree from Maseno University. So I would ask that kindly, if we, oh, I can see Ms. Shiroya is back.
Yes, apologies for that.
Dr. Shiroya, you, we welcome you back.
Thank you.
We had endeavored to try and move on from where you are, but now that you're here and you're ready and set, we will proceed with you. We apologize to the ones who are expecting us to go to the next speaker. So I know that with the permission of the participants, I can now go back to Dr. Shiroya. I had already mentioned that you are a pediatrician and you're public health specialist with WHO, and that you're going to speak on the enabling policy environment for children 0 to 5 years. So Dr. Shiroya, you can carry on.
Thank you. I hope you can hear me clearly.
Yes,
and thank you for the opportunity to share on creating an enabling environment from the health perspective. The next slide. Next slide, thank you. To begin our reflections, I'll start by going through the key elements of the Nurturing Care Framework. Now, this is a document that was launched alongside the World Health Assembly in 2018, and the document has been instrumental in the way countries around the world ensure that children everywhere have the opportunity to survive, thrive, and reach their full potential. As we see from the diagram, really nurturing care is a set of conditions for children's health adequate nutrition, safety and security, opportunities for early learning and responsive caregiving. So nurturing children means that you keep them safe, healthy and well-nourished, paying attention and responding to their needs and interests, and encouraging them to explore the environment and to interact with caregivers around them. Nurturing care is not only important for promoting young children's development, but it also protects them from the worst effects of lowering their stress and encouraging emotional and cognitive coping mechanisms. Next slide. And therefore, on the next slide, we see that the nurturing care takes a life course approach in supporting early childhood development. If we look at the first 1,000 days, improved health of the parents leads to improved health of the baby. And interventions, guidelines, or strategies that help to ensure a healthy and safe pregnancy are important. And examples of this include good nutrition. Please go back to the previous slide. Good nutrition, micronutrient supplementation, issues related to maternal mental health, for example, all interventions that lead to early diagnosis of various infections, as well as a clean environment. All the interventions related to pregnancy will actually ensure that we have a good environment for a healthy baby, because a healthy mother, a healthy parent leads to healthy children. In the first 1,000 days, we also note that the interventions that relate to children in their early years, and in this particular case, I would like to highlight interventions such as breastfeeding are also important. And therefore, policies and guidelines that enable us to protect breastfeeding are an example of how we ensure our children have got the best chance in life. In the next slide, we note that really the aspects related to early childhood development relates to two action areas. So they are actions around what the child's brain and body expect and need, and then what is the environment around them, what we call an enabling environment for nurturing care. So this enabling environment for nurturing care, if you just click, it will show the second diagram. The second diagram will display. Thank you. In this diagram, we see that we have the eccentric circles, that the center of it all is actually the caregiver, and we have all the elements around for the nurturing care framework. And then we have the other empowered community, as well as the enabling policies. And so any policies or strategies that protect the family, that empower the community, are actually essential to be able to ensure that this child not only survives, but thrives. So the two action areas relate to the 5 components that we spoke about, but the second action area pertaining to enabling environments is around the parent and the caregivers who play a critical role, but they can't do this alone, and therefore community services and policies that are directly or indirectly supporting families and young children are therefore important. The resources, the skills around this are then important. In our next slide, we see an example of how this works. What are some of the enabling policies that provide caregivers with time and resources? These are policies related to maternity protection. Do we give our mothers enough time for maternity leave? Is there paternity leave? Are we protecting breastfeeding, for example, which is a key intervention in those first 1,000 days, by having protection from marketing of breast milling substitutes? Do we give breaks for the mothers to be able to breastfeed their children? How is our environment and air clean and safe to ensure that we have a good environment for children? So there are numerous policies that span the different sectors, including the health sector, that are needed to create this enabling environment for families to provide a nurturing care. And so we see that there's a lot of integration of various policies. We see a lot of integration of interventions. They cannot act alone in order to provide for this. And this is, I think, very critical. In the next slide, we appreciate that The next slide. We appreciate that this existing opportunity to support nurturing care framework in health, again, take a life course approach, and they are found in different areas. For example, right from the newborn, neonatal area, the postnatal, but also in the immunization clinics, and also in some of the NCD clinics as well. And we have opportunities in various contact points in the health sector to ensure that there's integration of interventions, of passing on information and knowledge. So therefore, policies that allow integration of healthcare services, that allow healthcare workers to be passed with knowledge and skill, then this becomes important. On the next slide, we see various guidelines that WHO has. The next slide, thank you. That WHO has produced to be able to support the nurturing care, and these are guidelines or formative normative guidelines to support countries, to support ministries to implement this. What we have here is improving early childhood development, which emphasizes the need, for example, for integration and strengthening of policies around health and nutrition. In addition, it also stipulates that children should receive responsive caregiving and early learning opportunities in the first few years of life. The next slide also shares another guideline which WHO has produced, and this is called the Nurturing Care Practice Guide. And this is a framework put together by WHO and UNICEF, and it enables program developers, managers, and service providers to build and complement on existing training packages to see how to integrate the key components. And hence we see again, that when it comes to creating an enabling environment, we need to be able to integrate and to build on existing systems and to complement. Our next slide also just highlights and shares various sets of tools that are available, and also links where you can get more of this information. Next slide. On the tools, thank you. On the tools, I think that's the one preceding, and we'll be able to share a link on that. So just to summarize as we come to the end, what we are saying is that they are basically strategic, the 4 strategic actions to that enabling environment is around leading and investing and taking a multi-sectoral approach. And as we saw in the ecosystem, the focus is on the family and on communities, but strengthening existing services and really being able to monitor the progress while looking at how to scale up. So we are complementing and integrating and focusing on a whole community approach to be able to support the child. I think that brings us to almost the last slide. And this slide just re-emphasizes, next slide, that when we operationalize the nurturing care framework for ECD and we look at the enabling environment, it's really a 5-level approach, as we said. We are leading and investing, we're focusing on the family, we're strengthening existing services, and then we're monitoring and scaling up. And thank you so much for the opportunity to listen to me. The last slide.
Thank you very much, Dr. Shiroya, for taking us through that journey. You have highlighted the fact that we should adopt a life course approach, and you also mentioned the whole of community approach. You have mentioned the need to have integration of policies to build on existing systems, and also you have mentioned the need for complementing what is available, and I also highlighted strategic actions that need to be taken. And for those who are listening, we give you the chance we continue to encourage you to note your feedback on the chat and questions on the chat, and hopefully Dr. Shiroya will be able to respond to a few of your questions when we come to the end. We now want to move on to the next presentation. We will invite Mr. Elijah Bonyo from World Vision Kenya. He's a Director, Policy Advocacy and Government Relations, and he's going to discuss with us strengthening policy implementation for early childhood development in Kenya. Having heard from Ms. Njeru, and then heard from Dr. Shiroya, Now we want to see what opportunities are there for us to strengthen implementation. Elijah, Onyo, carry on.
Confirm you can hear me, Mwanaweza?
We can hear you. We can hear you.
Thank you. Thank you very much. And I would like to just begin by sharing one of the key takeaway from the first two presenter that I think we need to take more seriously. I think the whole question of data has come out from the first two colleagues, and therefore, as a network, to be important to prioritize data. The second thing, before I get to my presentation, that has come out very clearly, there are several policy frameworks that are associated with all the components of nurturing care, and perhaps it will be useful for some mapping on what are the policy gaps in each of the components of nurturing care. So colleagues, for my session, I want to begin by, number one, just encouraging us to engage in politics. Let us engage in politics of promoting early child development. In Kenya, many citizens, most of the time, listen to political leadership. So at the end of the day, what politicians say sometimes shape how policies are implemented. So we could be having legal frameworks or policy frameworks. But remember, as a politicians that then decide on the legal frameworks that already exist. For example, you are aware that the early childhood law that was enacted passed by the Senate, it was a political process. Right now, the country is struggling with implementing the recommendations of the Presidential Working Party. Again, it's going to be politics. So as we talk about enabling policy environment or strengthening policy for ECD, let us ask ourselves some two questions. Which precedes the other? Ideally, Kenya Law Reform Commission, KIPRA, recommends that policy frameworks should have enabling legal frameworks or regulations to implement them. So listening to the colleague from the Ministry of Education, if indeed we have those policy gaps that are being pointed out, are they policy gaps that we should cure with the legal frameworks? I think that's something that we need to do as a network. Important to note, the guidelines are critical. So the policies that we have across all the components of nurturing care, which guidelines exist for implementing them? And do these guidelines clarify on the roles of every actor? The pre-primary education policy, for example, has very good standards that clarifies the roles of various actors at different levels. Thirdly, again, like I said, do we feel politicians can champion ECD? Today morning, we had a meeting with MPs, all the MPs, the MPs from Nairobi County, basically the 17 constituencies. And the discussion was, how do we prepare for grade 9, given that grade 9 is to be housed in primary school? And there's the question of infrastructure for grade 9. And you are looking for political commitment from this member of parliament to invest CDF on infrastructure for grade 9. So how many of our politicians, MCAs, senators, members of county assembly, who are MCAs, of course, and National Assembly, are aware of what you're talking about here? I think as a network, let us prioritize political engagement. Next slide. Next slide, kindly. Okay. Now, the issue of planning and financial resources also came up in the first two presentations. So what is our current context? We may talk and talk and talk and talk as a network all the time, but we should be aware the current administration is already implementing a 5-year plan. The Kenya Kwanza administration, they're already implementing the 4th medium-term plan. Several departments of government, especially Ministry of Education, already have their national level strategic plans or sectoral plans. County governments already have CIDPs and sectoral plans in some cases. And of course, we have the annual development plans and annual work plans. So my view would be, we may need to interrogate the place of ECD in the implementation of these plans. The law allows us to recommend for amendment of these plans. So we shouldn't be moving forward in the next financial year with gaps that can perhaps be cured through proper planning. Plans without resources, again, would not be implemented. So when you move from policy to guidelines to plans without financial resources, again, we may not be able to implement properly. So policy implementation will require huge financial resources, especially if these policies were costed. So perhaps what we should be doing as a network moving forward is to ask ourselves, if you pick the pre-primary education policy, what does it take to implement the pre-primary education policy in each of the counties? And are county governments budgeting for pre-primary education based on the pre-primary education policy? Are county governments budgeting for child health care based on the national health policy, for example? Are county governments budgeting for child protection, social protection based on the national social protection frameworks? So it's critical that we link the policy, the plan, and of course, financial resources. The last slide. Human resources is critical. We may talk about building capacity of people, but are these people properly hired? The previous discussants talked about personnel for pre-primary schools, personnel for the health sector. So do we just talk about personnel, or we need to look at the standards? What is the ratio of teacher to pupils, for example? What is the ratio of community health promoter to community members or to households? What's the ratio of a nurse, to patients? So we really need to look at what are the standards we require to ensure we achieve adequate human resources. And then what are the competencies? We may need to consider continuously building the capacity of the human resources we have. That again, in itself, will require financial resources. Importantly, people's voices, voices of communities, voices of women, voices of persons with disability, voices of children. In all the stages of policy implementation, we need to ask ourselves, are we listening to the views of the policy beneficiaries? And as ECD network colleagues that are here, are we also being listened to by government in the journey for policy implementation? So as government implements the policies across all sectors, are they listening to civil society? Is government listening to the private sector? Are they listening to community? We may not say that policies are properly being implemented because the technocrats in government are providing evidence for that, but what are the people's views on the status of policy implementation? That takes us to social accountability, and our colleague who talked about nurturing care brought it well, social accountability, or we may want to call it public accountability. So where is the evidence? And this evidence should not just come from the state-led research or state-led M&D. Where is the evidence from citizen-led processes? We may need to ask ourselves as a network, do we have community groups that are engaged in social accountability? Do we have community groups that are monitoring service delivery in pre-primary school, in health centers, in child protection centers? Because citizen-generated data might provide more information on the status of policy implementation over and above what government presents. Thank you for listening, and I'll be happy to take any comments as guided. Thank you, and back to you, Mwanaweza.
Thank you very much, Bonyo, for taking us through that very enlightening presentation. You have spoken about prioritizing political engagement, about linking policy and plans and financial resources. You have spoken about the need to listen. We should be a listening network, and also the gathering of evidence that is citizen gathered, and then a citizen-led process of using that evidence to drive accountability. Thank you very much, Elijah Bonyo. And of course, if you've got any questions, we encourage you to write them down. We will have a chance for Elijah Bonyo to respond to them at the end of this webinar. I now want to invite Honorable Jezan Farouk of the Mombasa County Secretary and the Head of Public Service. He's going to speak on strides the county has made in promoting policy in children's health, protection, education, and child care. I had already mentioned earlier, but there's no harm repeating this, that he has over 14 years of experience in both public and private sector, and is an advocate of the High Court and a certified secretary registered with the Institute of Certified Secretaries. Honorable Farouk, please proceed.
Thank you. Good afternoon, ladies and gentlemen. I'm glad to join you this afternoon and share my thoughts. I'm happy with the presentations, very enlightening, something I've learned a lot. The presentations by Bonyo and the previous my previous presenters. This is a very interesting topic on matters policy, governance, and financing of ECDs. Just to pick up on the discussions, perhaps just in a minute or two, is that we are currently working on our statistical data abstract. We want to have our own sort of in collaboration with Kenya National Bureau of Statistics to develop our data center, as well as ability to consolidate data based on research that we're currently doing across the various departments. This will inform largely the discussion we're having today on matters policy. Most of the policies, unfortunately, that we end up developing are not really informed by research. So we've through the Governor's Manifesto, this is one area that we want to venture into, and issues as well to do with institutional reforms, legislative reforms are largely going to be done based on research and data. So even the aspects of implementation of the medium-term plan 4, a lot of the issues that have been raised in that medium-term plan focus around evolved functions. So we are part of our plans in this financial year is now to see the kind of reforms we need to put in place, and as well as capacity building towards ensuring we are up to the task. So straight ahead to my presentation, I'm glad to present on the strides the county has made in promoting policy in children's health, protection, education, and childcare. So maybe the next slide. So yes, education ECD in particular and vocational training is a devolved function under Schedule 4 Part 2 of the Constitution of Kenya 2010. And the department we have 4 directorates in the Department of Education. We have ECD and libraries, quality assurance, standards and childcare, administration and human resource, and vocational training. Next slide. So the Constitution of Kenya and subsequent to Basic Education Act transformed the delivery of services in education. So particularly Section 18 now provides for the administering of ECD education in counties. Next slide. So a bit of statistics. So according to 2019 census reports, you see that one of the reasons we want to have our own data is we cannot rely on 2019 data. Unfortunately, that is the official data that we have. But going forward, our plan is to have up-to-date data. So according to 2019, we have 175,777 children under the age of 5. There are 47,867 children within the 4 to 5 who are attending ECD education, both in public and private. So there are 98 public and 770 registered private ECD centers currently in Mombasa. This indicates that the children who attend the public ECD centers are 18.2 of all the ongoing school children. So it means we are missing quite a number in terms of access to education. So Mombasa County's stride in promoting child welfare. So Mombasa, we have the county child care bill of 2024. We are still in the process of doing the public participation. We have not yet done the public participation for this one. Then we have child care facilities. We are currently working with Nurture First on home-based care and school feeding program. Elimu Fund Scheme. Now this is the current act based on the Basic Education Act that provides the access to bursaries for our school-going children. Then we have access to quality education, that is capacity building of ECD teachers and a Tayari digital learning program. As part of our, we've introduced a bit of digitization as I shall show later in our ECD centers, where we want to equip our children with basic IT skills, including coding. Then as we deal with health, as we deal with education, we cannot run away from health. So the governor introduced what we call the ASN, that is Abdulswamad Sharif Nasir, under 5 care, whereby all children in Mombasa access free health care, regardless, inpatient, outpatient, so long as you're a resident of Mombasa. We also have the newborn unit that was established at Coast General, state of the art, in support of with the Czech Republic, as well as supportees, and library services and monitoring and evaluation. So the Mombasa County Child Care Bill that we propose provides for the assessment, registration, licensing, management of all child care facilities in the county for matters incidental thereto, because currently they are not properly licensed. There are those that are operating as child care, they're not properly licensed, and we want to license, including issues to do with madrasas and Sunday schools. So it addressed 5 areas as follows: home, school, transport, religious institutions, and recreational facilities. The act is being repealed to accommodate home-based childcare, which had not been captured previously. Next slide. So home-based childcare, again, the department has identified and conducted mapping and baseline quality needs assessment of 2,300 home-based childcare. And, this 2,300 alone accommodate 9,000 children. So you can see most of the people who are perhaps those in the lower aspect of economy find this more accessible. So mapping was done in collaboration with the Department of Health and in partnership with Nature First, an organization under the umbrella of Global Development Incubation. So we have, as part of our devolved functions, we've, in terms of our infrastructure plans, has been our ECD centers. So currently constructing 8 model schools with a total of 50 classrooms, fully furnished, modern dining and kitchen, administration block, and a sick bay, as had been proposed by some of the previous presenters. So in addition, the county government is refurbishing and modernizing 16 ECD centers across the sub-counties with a total of 64 classrooms by the end of this academic year. Then the school feeding program. The ECD, this is another of the first projects we've introduced under the new administration. The Mombasa leading, actually, we are the leading county when it came to school feeding program. So the ECD program is providing partnership with Food for Education at a cost of 84 million. It was launched by His Excellency the Governor on 15th of February last year. A daily hot nutritious meal is served to 10,233 learners in all ECD and specialized units, courtesy of the Governor. So the Department of Education has a line budget that supports the program based on our shilling to shilling PPP agreement as per the MOU we have with Food for Education. So that is one of the pictures we have with whereby the governor is feeding our children. You can see that's maharagwe and rice, very nutritious, very hot. And we've gotten very good reviews from parents, from teachers, the students themselves. It's encouraging them to go to school. Otherwise these children prior to this were not getting any form of basic meal. The parents were struggling whether to afford a meal or to take a child to school. But at least we've now reduced that burden of a parent. Now he has no excuse, he or she has no excuse but to take the child to school. Next slide. So this is another new first we've introduced as a county. The capitation grant in the county government will ensure enhanced access, quality, equity, inclusivity, and efficient management of early development and education centers. So every learner will receive a capitation grant of 3,200 per financial year. And we want to start this financial year. So the disbursement will be done in 3 tranches. That's 50%, 30, and 20, adapted from the Ministry of Education capitation grant model, meaning that no parent will be forced to pay. So everything has been catered for, so long as you're a parent or your child is a resident of Mombasa, your child will be provided free meals and free education. Exciting times to be in Mombasa. So the development of staff is a key indicator of efficiency and effectiveness. We take our personnel very seriously. So the county government of Mombasa has partnered with various stakeholders to enhance the professional capacity of ECD coordinators, quality assurance officers, and our over 200 teachers. So this includes the digital literacy, value-based education, leadership, and supervisory skills. You can see them. Those are our teachers who are actually learning. So the emphasis is not just on children infrastructure, but also on the personnel, our staff. So health and well-being, yeah. So part of when it comes to children, you have to provide some matter of the basic rights of a child. It's about nutrition and their health and well-being. So we provide vitamin A supplementation, deworming programs, administration of polio jabs, and of course the under 5s and the newborn units. So the picture below, okay, the previous slide is now the newborn unit. When you are, I wish you could get better photos, but yes. So that is basically the newborn unit at question. So we can go to the next slide. So co-curricular, yes, even in our, so just not learning, but also playing, making education fun. So you can see our children are learning coding and robotic skills. These are first of its kind in Mombasa. They're busy in sports. They take part in music festivals, sorting and grouping, just to build their capacities, IQs, EQs, and the like. So monitoring of childcare programs, yes. So the department is mandated to monitor the following programs: the school feeding, capitation, all childcare facilities, competency-based curriculum implementation, infrastructure development, together with the Department of Public Works. So the Department of Education does this a lot to ensure quality assurance. We monitor, we implement the policies, the regulations, the acts that are in place. Final slides. Yes, thank you very much. So that's just a summary of the policy, institutional, and legislative frameworks that we have in place, in addition to the other programs that we plan to introduce. Thank you very much. I'm open to any questions or clarifications that may be required.
Thank you very much, Honorable Jayzan Farouk. And we can obviously see why we should be in County 001. The reason why is County 001. Just a quick one for you, and you can answer in less than a minute. Do you think, Honorable, that the responsibilities of county governments as set out in the Constitution are being properly addressed by county governments?
Well, the Constitution provides that resources follow functions. Recently, we've had a challenge with, the most recent devolved function was the libraries. Unfortunately, even with the libraries, we managed to get less than the staff were actually devolved. For example, there was a problem with the revenue allocation. These are some of the challenges when it comes to devolution. Education, health, are inseparable, because these are part of the social programs that have been devolved. So the challenge has been largely about the resources. We currently have a challenge when it comes to personnel. The personnel that we have a very, according to the regulators, we have a high wage bill. And the wage bill is as a result of the nature of the devolved functions. The devolved functions are highly capital intensive. You need teachers in ECDs to have a proper teacher-student ratio. Then, yes, so the challenge has been the resource, the funding of these functions has always been the challenge. So trying to create that balance in terms of service delivery as well as meeting operational needs has always been a challenge. So that's why we've had to come up with innovative programs such as capitation and food for education, because we still have a future. We have a generation to provide for our children, regardless of whether you have the resources or not. So we're trying to see how we can balance the building of schools, but also providing quality education.
Thank you very much. For building on what you're just saying, Lydia, there's a question for you. Should we have this ECD at county level? Why do governments, is being asked, why do government hesitate on transferring ECD level of education to national government? I know that Mombasa is doing an excellent job, but the question on the online is why do governments hesitate on transferring ECD level to the national government? What are your comments on this, Elijah?
Is the people to, you know, it's us past constitution. Pre-primary education is a function of county government. You cannot take pre-primary education as a function of back to national government easily, as we are saying here. So it's upon us again, if parents and their children and their communities would like to have pre-primary education retained.
Elijah? So
did you hear me?
Yeah, you are saying that it's a constitutional, it's in the constitution, so we can't just take it back.
No, I'm saying it's up to us. You see, if some of these things, it's citizens who should be able to shape policy.
Right.
And it's upon us in this network, for example, to shape community conversation on the issue of whose function should it be pre-primary education. If we shape the public conversation to have it remain in the county governments, it will remain there. If you shape the public conversation to take it back to national government, it may go back there. So sometimes we are quick to say policymakers or executive is initiating decisions, and we fail to realize that we equally have a right as citizens to propose what we want to be done and defend what we want to be done. Thank you.
Thank you very much. Dr. Shiroya, building on what DJ is saying, that we voices from the community can shape policy. The question for you was, what really is missing, having looked at the policy framework? What really is missing and should be advocated for before it is too late? Do you have any priorities that you think we should be working towards in terms of advocacy, Dr. Shiroya?
Yes, thank you. So I think by and large, we are on the right track in terms of beginning to appreciate as a country the importance of ECD. This is, as we noted, an integrated approach that involves all sectors, but primarily we have the education and health sector. And as Director Emis has shown, and as I am aware of, there is closer collaboration between the different sectors. I think what needs to now happen, now that we do have, or we are at a stage where we have a clear enabling policy environment, is how do we now move to the subnational level? How do we ensure that the structures are in place to be able to operationalize the spirit of the policy? And how do we then, as has been stated by colleagues, ensure that there is support in terms of funding and also capacity building the various stakeholders? And perhaps even more importantly, ensuring that the community are empowered, because as we noted, they are the center of this, and families are also the center of this. Thank you, and back to the chair.
Thank you very much. Lastly, for Director Njeru, the question is about how well ECD is being governed and managed at county level, and whether what you think needs to be done to bridge any gaps that exist in terms of managing and governing ECD at county level. Briefly, please. Director.
Thank you very much. How is ECD governed at the county level? Each county governs the ECD provision differently because counties are unique. And no wonder there was the recommendation from the Presidential Working Party. We have a comprehensive school system, whereby the ECD will be under the head teacher of a public school. The reason why I'm saying this is because some counties have managers, have directors who are not teachers, who are not professionals. And this group can tell us, how can a procurement officer manage education. It is impossible. Teachers are professionals. They are trained on how to manage learners. They are trained on how to deal with the children. But a person who is not a professional cannot manage an education system. Starting from that. On the other hand, we need professional teachers. Some counties are not employing professional teachers. They're just employing people in that position as a caregiver in a PP1, PP2. We are confusing our children. And what will happen, we'll have some counties lagging behind as far as provision of quality of education is concerned, hence affecting their people, while others will be doing so well. And I would like this group to also do an assessment, because as a director, I've also done my assessment in some of these schools. I've gone to urban schools and gone to remote rural schools. When you compare the two in these counties, you see a very big difference. And at times we should ask ourselves, are we enhancing equality, or we are widening this aspect? Because unless we look at pre-primary education, the gap as far as provision of quality education is concerned will be wider than we have ever thought about. Right now, the Ministry of Education has started a program for foundational learning from grade 1. And of course, we are realizing learning poverty being witnessed in some areas. Why? Because the provision of education PP1, PP2 is wanting in some counties because of poor teacher qualification. The counties are not providing relevant learning materials. If they have materials, they are not relevant for CBC, and this child will get confused when they get into grade 1, because they will now embark on CBC, and they have not been taught or brought into appreciation of CBC skills. So there are all these gaps, and it can only be dealt with if we have professionals managing the education sector at county level.
Thank you very much. That's very well put, Director. I want to thank every one of the presenters that have presented this afternoon. I know that there are other questions that you raised on the chat that have not been addressed. We will endeavor to share them with each of those presenters, panelists, so that then we can endeavor to get you back those responses. And some of those questions will also inform future webinars that we will be having. Thank you very much for your participation in the course of this afternoon, for your patience with some of the challenges that we had with the connectivity with some of the panelists earlier, and for your contribution and the questions. I want to then ask Dr. Teresa Momo to just close us with a thank you, and then we'll be done. Dr. Momo, please.
Okay, thank you so much, the chair, for this session. And thank you to all our able presenters who have shared their insights on related to policy. Dr. Makeba, Honorable Jason, Mr. Raicha, Madam Amy, our board representative, Madam Lily, thank you so much. To all our participants, both from Kenya, from the different counties, those who joined us from other countries, we truly appreciate your support. And to our board members who also joined us in this particular webinar, we truly thank you. We will be continuing with the series of webinars going forward. Some, like the chair has indicated, will be addressing the questions that you raised so that we are able to be informed on how matters affecting young children are happening and are being handled. So I want to wish you all the best as we plan again to meet in the next webinar. Thank you, and over to you, Chair.
Thank you very much. Thank you very much. Have a good afternoon.